payments to businesses this week. These funds will be critical as they are targeted towards Wisconsin's small businesses and the folks who need it the most. WEDC staff from all departments are working to verify information with individual businesses as quickly as possible and hope to have everything completed by the end of summer. If you applied for the grant program but haven't heard from WEDC yet, they will be in touch. In addition to working on the We're All In grant program, the Wisconsin Economic Development Corporation released a report on the economic state of the state as we continue to battle COVID-19 and lays out some priorities for future economic success. One of the top priorities outlined by WEDC is the need for high-speed broadband access for every business owner, farmer, worker, and student moving forward. Overnight, as Wisconsin schools shifted to virtual learning and a large number of people began working remotely, we changed how we live, work, and learn in order to adapt to this virus, which has highlighted the digital divide in our state. Now more than ever, a strong state's economy is closely linked to access to high-speed broadband for our schools, businesses, and homes. That's why I'm proud that in our last budget, we are able to make the largest state investment in broadband to expand our broadband expansion grant program to reach more underserved areas of our state. And today, we announced the Governor's Task Force on Broadband Access, which will be tasked with going beyond funding and finding innovative, creative solutions to the broadband disparities in our state. This group is comprised of industry leaders and various stakeholders from across the state, and I look forward to their good work this summer and this fall. Because broadband access is not a luxury, but a necessity, especially as we continue to navigate learning and working through COVID-19. At the end of the day, what the WEDC report shows and what we knew already is that there isn't an industry or region that doesn't have challenges ahead. The COVID-19 pandemic has impacted every corner of our state, every household, and every industry, and the people of Wisconsin deserve a productive effort from local and state and federal leaders. One way we're doing that is with our Roots to Recovery program, which invested $200 million of CARES funding to reimburse local governments for the expenses incurred to address their COVID-19 recovery needs. The first round of expense reports are due tomorrow, and reimbursement payments will shortly follow so our local government partners on the front lines can continue supporting their communities and promoting local economic recovery. Wisconsinites are resilient, and I know that if we can continue to put the health and strength of our communities first, we can bounce back together. And this challenge belongs to all of us. The economic recovery of our state depends on our public health efforts. Every day, our administration, the Department of Health Services, and the Wisconsin National Guard are working tirelessly to contain the spread of COVID-19. We have conducted more than 650,000 tests across our state, and unfortunately, over the past couple of weeks, we have seen positive cases of the virus increase at an accelerated rate that cannot be explained solely by our increasing testing ability, with some of our record daily increases in the last week. We need to get back to working together to flatten the curve so our healthcare systems don't become overwhelmed, as we have seen in states across the nation where doctors are making difficult life and death decisions for their patients. The situation is still serious, folks. Fall is right around the corner, and believe me, I am as worried as you are about what school is going to look like for our kids and educators, whether or not we're going to get to watch the Badgers play, and how seasonal businesses will operate safely. But the good news is that we have the opportunity now to set the stage for later. As I said last week, it's all on us together to take responsibility for our role in reducing the spread of COVID-19, and we need everyone to continue doing their part by staying safer at home whenever possible, practicing social distancing, and wearing a face mask whenever they go out in public. Without a vaccine in sight, these are the best tools we have at this time to not only save lives and prevent hospitalizations, but to ensure our schools, our workplaces, and our local businesses and our communities can stay open. I know some will try to make wearing a mask a political issue, but it's a public health issue, and it's certainly an economic issue. So wear a mask, not only to protect your own health, but also the health of our frontline healthcare workers, small business owners, essential workers, first responders, and many more of our neighbors doing the critical work to keep our communities up and running safely. And now I'll hand it over to Secretary-Designee Andrea Palm for her COVID-19 update. Secretary-Designee, it's all yours.
Thanks, Governor. Good afternoon, everybody, and thanks for joining us again today. And today I will start out with our numbers. The death toll here in Wisconsin has reached 826. There are now 37,906 confirmed cases of COVID-19, which is an increase of 964 over yesterday. In the past week, we have increased our cases by 5,350 and broken our previous record for positive cases 4 times, including today. These numbers are not the result of more testing. In fact, on Saturday, we saw more positive cases than we saw on Thursday, even though we tested half as many people. Our percent positive remains high, and these numbers are the result of significant community spread here in Wisconsin. What does that mean? It means we need to double down on protecting our families and our communities. It means staying home and limiting our trips to the essentials. Wash your hands frequently, practice physical distancing, and wear a mask if you can do so safely. Another way to protect your community is to get tested. If you have any symptoms, even mild ones, or if you don't have symptoms but you know that you've been exposed to COVID-19, please access a test. Call your healthcare provider or go to one of our community testing sites. We know Wisconsin has community spread. We know that people with mild symptoms and people who have been exposed and are positive but asymptomatic can and do spread the virus. In fact, we know that people who are mildly sick or asymptomatic are more likely to spread the virus in the community than people who are severely ill, because those folks are less likely to be interacting with large numbers of people. And that is why minimizing your interactions with others and getting tested if you need to is so important. Wisconsin summers are beautiful. Businesses are opening up. Taking all of these precautions is draining, and it's easy to get discouraged and tired. It's easy to let your attention slide, to accept the invitation to that barbecue, or to gather some friends for a drink. But again, this is what we know. We know that gatherings as simple as barbecues and bars can and have spread COVID-19. And we know that the virus goes beyond those first few people who are infected. An infection at a barbecue can quickly spread from those attendees to their daycare provider or to a coworker or other relatives. And the biggest danger is that one of those people is vulnerable to severe illness or death from COVID-19. That is what community spread means, and it can quickly become difficult to trace and box in. It makes it much more difficult for local public health departments to stop the spread. It means that you are at risk. But together we can choose to reduce our risk, to take precautions and help keep our communities safe, including our essential workers and our healthcare professionals. These are our choices. And we see our cases climb here in Wisconsin. Now is the time. We need to work together again to flatten the curve and stop the spread.
Thank you. We will now open this up to questions. A reminder to maintain audio quality, keep your phones on mute until it's time to ask your questions. In the interest of time, please only one question per reporter. And we will begin with Scott Bauer from the Associated Press. Scott?
Hi, thanks again for doing this call. I had a question about the number of tests that have been given in recent weeks. The Badger Bounce Back Plan set a goal of 85,000 a week. And over the past 14 days, not counting the numbers you just reported, it looks like we had 70,000 last week and 61,000 the week before. Nowhere close really to that 85,000. What effect is that having? Why are we not hitting that number? And what's being done to try to get up to that goal?
Thanks, Scott. That's a super important question. I think there are a couple of things going on here. One, we certainly have seen increased demand as we have seen a surge in the state. And our community testing sites that the National Guard are staffing for us are busy. They're very busy. And so it continues to be our goal to meet the 85,000 a week. It continues to be our goal to build beyond 85,000 in anticipation of the fall. But I think the other thing that people need to remember and understand in context here is that our capacity, our lab capacity, is actually about 170,000 tests a week. We, within the state of Wisconsin, if we ran 170,000 tests, we would have labs to process those tests. And so while we continue to encourage people who have mild symptoms or who have been in close contact with a positive case to get tested, we have continued to build the capacity across the state so that we can continue to encourage people who need to get tested, and that we can continue to have the capacity in our labs across the state to run those tests.
All right, and now we'll go to Molly Beck at the Milwaukee Journal-Sentinel.
Hi, Patrick Marley. I'm filling in for Molly. She was unable to join us today. Thanks for having this call. Governor, I wanted to ask you about schools. Do you want to have in-person school this fall, or will you order schools closed as you did in the spring? And if you haven't made up your mind, when will you make that decision, given that schools are to open in about a month?
Yeah, and I anticipate that schools will open by early September. And that leads me to something else that just has to be said. Clearly the surge and the numbers are increasing. And if we do want schools open safely, we need to all get behind it. I know not everybody has a kid in school, but you also know how important schools are to our future and the quality of life in this state. So whether you have your own children or not, I'm really encouraging you to take it easy, be as safe as possible, wear a mask, don't get into small rooms with a whole bunch of people that don't have masks, and help us make sure that schools open safely. The schools did receive information from the Department of Public Instruction, which coordinated not only with the Department of Health Services, but with education groups all across the state. Laid out several different options for people that are people locally can use to make the decisions. It's going to look different in different parts of the state. And we're already seeing it. Milwaukee Public Schools is looking to start the year virtually and then morph into a more regular situation. But I believe that we can open schools, and so I am not in any position to say we're going to or we're not going to, and I'm going to order them closed. That gets at an issue about what orders I can do or not do, but I'm still optimistic that they can open, and there's lots of options. But if people really want those schools to be open, we all need to pay attention to it and pay attention to our own health, and then I think it'll be much easier for them to open safely.
All right, our next question will come from WKOW TV in Madison, Danny Maxwell.
Hi, I just wanted to follow up with the testing capacity, but specifically, we got word today from a lab that does testing nationally, but also locally here in Wisconsin, that they were seeing the demand so high that their turnaround time for results is going up and up. In fact, they say for non-priority tests that their results may take 7 days. So I'm wondering what the reason for this high turnaround time is for some of those labs, and do the results even matter after 7 days or more? Are they kind of moot after a certain time period?
It's a great question, and we obviously, it's part of why testing has been a priority for us, and within that priority, right, diversifying the technologies that we're using in testing, so that if you have a supply chain issue with one technology, one particular kind of reagent or one particular other kind of supply, that we have diversified the kind of technologies we're using here across the state to minimize those kind of impacts. I think we still absolutely have a vulnerable supply chain when it comes to testing, and we continue to track that closely. But it is also why we have really tried to build capacity within the state of Wisconsin, because I think what we know is that the majority of our tests are resulting in under 2 days, and that some of the labs that different systems or different folks are partnering with that are out of state are having a real crush of demand, like you suggest in your question, and that demand really is driving their turnaround times 7 days, 10 days, and into timeframes that do make it less meaningful, because, right, the goal is to have good turnaround times so that you can get to that contact tracing piece of this really quickly, because it is chasing those contacts, making sure they understand how to safely isolate, quarantine, get tested, do the things they need to do to help stop the spread. That is, part of, right, how we box in this virus. And so that whole continuum of priorities are things we have been focused on, we will continue to be focused on. But I do think it is part of why we continue to want to expand our capacity here in the state of Wisconsin, because we want to make sure that within the four walls of this state, we can continue to maintain turnaround times that allow us to do this work well. And as your question suggests, the higher the demand, the more taxing that is for labs, and that can potentially impact turnaround time. So we're focused on that. We do want to continue to build our capacity within the state so that we can do everything we can to keep them as low as possible. But I do think from that perspective, if folks are not getting results timely, I would encourage them to call. Sometimes there are anomalies in the tests, or there are human error in the entering of the data. Maybe your phone number got transposed. We've had trouble reaching you. So if you are somebody who is seeing test results beyond 5 days, I would encourage you to call, just to make sure that something hasn't slipped through the cracks. But I also would encourage folks on the front end, ask if your test is being shipped out of state, and then you can make an informed decision about how urgent and whether you need to think about seeking a test that will be processed within the state of Wisconsin.
All right, our next question goes to Katie Anderson from WBAY in Green Bay. Katie? Katie Anderson? All right, let's move on. Sean Kirkby at Wisconsin Health News. Sean, are you there?
Hi, thank you for holding this. I was wondering, can you provide any update on where the state is on hiring more contact tracers and whether or not that's meeting the demand is with the current surge? Thank you.
Mm-hmm. Thanks, John. I think I might have mentioned this in our last briefing, but it's hard for me to remember, so I'll say it again if I didn't say it already. We are in the process of hiring an additional 30 contact tracers at the state as LTEs. We did see, understandably, a little bit of attrition, and so we were looking to get back up to our 200 number that was our target initially, to make sure we were able to provide the kind of support to counties and local public health as they were seeing surges or seeing upticks and needed us to wrap around and provide that support to them. We are receiving requests daily for assistance with contact tracing, which we are continuing to provide, and through our pretty regular contacts with local public health, understand them to be handling their surges or their upticks or their caseloads, their need, and if not, are asking us for assistance. So we'll continue, obviously, to monitor that, and we'll pull more people in as we need to off our LTE hiring list, and continue to supplement what is happening at the local level. We also did, through the CARES Act, provide money to locals to bulk up their own contact tracing teams, and so they are also doing that work, again, to make sure that they're able to flex and do the contact tracing they need to at the local level.
All right, and our next question comes from Bruce Marcus at
Sorry. Excuse me, this is Katie Ann.
All right, Katie, why don't you go ahead?
Hi, sorry. Thank you for taking my question. I am curious, are all hospitals and labs able to do antibody testing? And if so, what's being done to encourage people to get an antibody test, since those who are asymptomatic seem to be an issue, and as you said, those who are asymptomatic are more likely to spread the virus?
Yeah, so I'm going to let Dr. Westergaard dig into the science here, but I think that it's important to understand that whether you are symptomatic or asymptomatic, you should be receiving a diagnostic test. An antibody test is not the test we're recommending to determine whether or not you have COVID-19, but we are doing some work in the antibody space that I'll let Dr. Westergaard dig into.
Yeah, that's right. Our efforts around using antibody tests are really on the research and epidemiology, or the surveillance side. So there's good reason to know on a population level how widespread has the epidemic become. So we at the state are systematically screening people throughout the state through several different projects to understand how many people have antibodies as something that reflects past infection. But I think the point that Secretary Palm made is the important one, is that antibody tests don't tell someone if they're infected now. They don't tell us whether they're infectious or contagious. And the other thing is, it doesn't tell us whether people are immune or protected from future infection. So really, those tests are a useful marker of being infected in the past, which can tell us some useful things, but they're not in the same category as the diagnostic tests, which are the ones that tell us whether someone's infected right now.
All right, and now we will head to Bruce Marcus with WRJO in Eagle River. Bruce? All right, we'll try to get back to him later. Let's move on to Aaron Mabin from WITI Fox 6. Aaron, are you there?
Hi there. Yes, I'm here right now. You know, there's a lot more mask wearing in our area with these mandates happening, and a lot of people have questions. So I want to know, what is the number one thing you want people in our area to know when it comes to mask wearing 101, cleaning up the mask, when to get rid of it, all of that stuff?
Yeah, I'll let the doctor run the...
Sure. It's a great question. You know, as we've learned a lot more things about this pandemic as we've gone in the past 6 months in a large range of areas of science. But in terms of infection prevention, we've learned about the ways in which face masks, both the medical grade PPE masks that we wear in healthcare settings, and also cloth face coverings in the general public, they've really emerged as one of the most important tools. So we encourage, we support everyone to take mask wearing as an important strategy on an individual level. Communities, organizations, businesses, universities who want to have mandates for people to make it a sort of the normal behavior among people in their facilities and their organizations. It's a very important strategy. So in terms of the individual behavior, what is it? You know, wearing a clean mask every day is important. Medical grade masks, generally in healthcare, we require some training on how to put them on and off. So if someone is an employee at a long-term care facility or a hospital or a clinic, they should get proper training on how to put on the different kinds of masks. In general, though, for the general public, the cloth face coverings, as long as they're clean and they cover both the nose and their mouth, and you wear them, particularly anytime that you're within close contact with someone, it should have a good effect. The most important thing is keeping the respiratory droplets and secretions, from getting out into the environment. So a clean mask, even if it's cloth and homemade, can have a big impact on that. So I would just say, consistency in wearing a clean mask, and try to avoid touching it, and realizing that when people touch their masks, that can also contaminate their hands. So it's not by itself the strategy, the most important strategy, but as a combination of hand hygiene and physical distancing, really tremendously important. So thanks for the question. It's something that we encourage everyone to do.
All right, thank you. Our next question comes from Rachel Glosh at TMJ4 in Milwaukee. Rachel?
Hi there. Do you believe Wisconsin is at risk of experiencing a large spike in cases similar to Florida, Texas, Arizona, California? What needs to be done right now to prevent that from happening? Thank you.
Thanks, Rachel. I think that's sort of the window of opportunity we have right now, right? Whether it was in March and April or now, we've been lucky in Wisconsin not to be on the leading edge, and we've had an opportunity to look around the country, whether it was Seattle and New York in the March-April timeframe, or whether now, as you suggest in your question, Arizona, Texas, Florida, other places that are seeing spikes and surges that are really taxing their healthcare systems to the point that they are having trouble effectively treating everybody who needs hospitalization. And so I do think that people should take very seriously the cautions of and the learnings that we're getting from these other states. Now really is the time, because of the way the virus operates and the lag in time of infection to symptom onset to potential need for hospitalization and severe illness, right? There is a time lag. And so if we wait until we are in that situation, we will have waited too long. And so now really is the time to double down on our work together. We did such a good job in the spring of flattening the curve and protecting each other, protecting our vulnerable citizens, protecting our frontline healthcare workers. And it really is time to do that again so that we don't have to learn firsthand the lessons that Florida and Texas and Arizona and New York and Seattle did before them. And so I would encourage everybody to take seriously social distancing, physical distancing, wearing a mask, the good hand hygiene, limiting your interactions with other people, returning to a regimen where you are really focused on your essential errands once a week. So really thinking hard about how do I reduce my risk and making decisions that do in fact reduce your risk and risk to others around you.
All right, our next question, Amy Reed from News 3 in Madison. Amy?
Hi, Governor Evers. Are you going to use CARES Act money to help people who are still waiting for unemployment benefits? Thank you.
Yeah, I saw that proposal, and we're looking at it, frankly, just in initial responses that was suggested by the Republicans. I view it as somewhat of a political stunt. I don't quite know how we're going to do it any faster using CARE Act. It's not as if we have a list of 300,000 people. Suddenly we're just to say, okay, we'll make a guess whether you're actually eligible. We'll send out a bunch of money. First of all, it takes human beings and an organization in order to physically do that. And second of all, it is